Do you have any words of advice for young people who may be considering medical transition? First of all, I will say that for any young trans person, you are going to go through some really, really hard times. And the first thing that is really important is that you make sure that you know that there are people out there who you can talk to. Hopefully it'll be your parents. If you don't feel comfortable talking to your parents, then maybe it's going to be a teacher, maybe it'll be a close friend. There are helplines like Switchboard, the LGBT helpline, the NSPCC. There are people that you can call and speak to. The most important thing that you realise is whether or not you go through medical transition, you are not by yourself. You are not dealing with this alone. There are other people out there who have been in the place that you are in and have asked the same questions that you're asking right now. And what's really important is that you don't feel afraid or scared or like you're suddenly abandoned. Then I will say that the other thing you have to bear in mind is that it's going to be a really slow process. And it's going to be a really slow process, and there isn't a map for this kind of thing. There is going to be really, really long periods of waiting. And make the most of these periods of waiting. It can feel terrible, particularly if dysphoria is hurting you, which is why it's important to make sure that you have people to talk to. Talk to your GP, talk to your doctors, and make sure that you map out a plan that's yours. Because there isn't one way to do this. There isn't one way to be trans. There isn't one way to go through transition. And what's really, really important, if you decide that transition is something that you want to go through, that you are doing something that is yours and it is for you, and that you fully understand. Read everything that you can. There are resources on the internet, there are resources from the NHS, there are guides that are written by medically trained professionals. Read them, make sure that you have an understanding of what it is that's going to happen, because you may find yourself sometimes in situations where nobody knows what is happening, even medically, as well as you do. And it's important that you highlight that you know what your rights are, so that you understand that you are protected by things like the Equality Act, and so that you know what the options are and the opportunities are. Because right now the world isn't running as fast as you are, the world hasn't caught up, and you may find yourself in a difficult place. Fundamentally, make sure that you have a support network, and then make sure that you are smart. Make sure that you read all the things that you can find, that you do all the research that you can. Reach out and talk to YouTubers and bloggers and people who are talking about these things who are maybe slightly further ahead on the road than you are, because they will really be able to give you some kind of perspective. And then be patient. Be patient, because it does take a really long time, but it happens and you will find yourself in the place that you're meant to be. On the worst days, you need to hold on to that, because the world needs to see what it is that you have to offer, and they need to hear what it is that you have to say.